Hi, I'm Parminder. I'm the director and principal physical therapist at Move Physio. The topic of today for discussion is osteoporosis, the role of physical therapy. Okay, so let's define what is osteoporosis. So it is the thickening or weakening of the bones which happen generally in old age, but mostly in women. Although people of all ages can get osteoporosis. Um, so in America, it has been found that 55% of people who are 50 years of age or above that, they have osteoporosis. So it's quite serious disease. And last time we discussed about the prevention of falls in elderly, which is quite closely linked with osteoporosis. So people who have osteoporosis or low bone mineral density, they are more likely to fall and get all kinds of fractures, which we discussed last time. Okay, so what happens, like because of aging, because of poor nutrition, or because whenever the bone like the bone formation is reduced or bone absorption is much more increased, there the bones becomes more fragile, more porous, and osteoporosis develops. So what happens whenever we are doing any kind of activity, even the minimal kind of forces which go through the bones while performing those activities, that actually leads to fracture. So okay, so yeah, this is like a kind of common underlying changes which happen. So who are mostly affected because of osteoporosis? So it is mostly seen in the women which are like who are like during the menopause phase. So first 5 years of menopause, we generally see in women the osteoporosis is likely to happen, also in men and children, but it is less likely. Also, it has been found that half of the women who have osteoporosis, they like to get fracture, or they likely to fall down and get fracture in any area of the body. Similarly, 1/4 of the men, they also somehow get the um, fracture of the bones because their bone mineral density is reduced. Okay, so besides men, children, and women, who else get this? So people who are who are paraplegic for a very long time, like the stroke patients. So recently I was studying a paper where the people who have stroke, the bone mineral density in the arm is very much reduced, so they likely to get the fractures. Similarly, the paraplegics who do not move much, so when we train them for all the weight bearing activities in the rehab setup, we actually promote the increase in the bone strength and bone mineral density. But if they are like mostly bedridden, they do not do their activities, and there is no tensile forces which are being applied by the muscle activity, there is a more likelihood for them to get osteoporosis. All right, so besides that, certain other diseases also make a person prone to osteoporosis. What are these? So rheumatoid arthritis, kidney diseases, cystic fibrosis, spina bifida, okay, and inflammatory bowel disease. So there's a list of diseases which actually can lead to osteoporosis. Okay, so now we'll come to the risk factors. There are kind of controllable risk factors and there are uncontrollable risk factors. So let's talk about the non-controllable or uncontrollable risk factors first. So if a person like the gender in women, so they are more likely to have osteoporosis. People who have small stature, advanced age, then there is some kind of hormonal and genetic predisposition is there. Also different kind of medical conditions which I just mentioned. Then comes the controllable risk factors, which with some kind of lifestyle modification, with some exercises or some changes in our diet, we can actually control them. So what are these? So cigarette smoking, if there is excessive alcohol intake, if there is a reduction in the vitamin D levels or calcium levels in the body, if the person takes too much too many drugs, like steroids or heparin, etc. If the person does not do any kind of exercises, or especially the weight bearing exercises. Excessive caffeine intake, inactive lifestyle, then poor general health. So all these are kind of controllable factors that where you can intervene and can actually reduce these risk factors. Okay, now the osteoporosis, it has been called as the silent disease because you don't find the disease like generally you need to see some kind of major consequences to happen, like the fracture or the afterfall, some kind of severe pain, etc. So yeah so if the person is a kind of middle age and old age, and if he or she experiences like the height is reducing, or there's a more of hunchback, there's a chances that the person is having some underlying changes in the bones. Then secondly, if there is a like the pain between the shoulder blades and like on the bones near the waist region, on the crest of the pelvis, so that also is a suggestion that the person might be having osteoporosis. Besides that, if the person is having generalized like the body pain or pain in the joints or bones, that is also suggestive of vitamin D deficiency or some kind of underlying bone pathology. So yeah, so because of this osteoporosis, various type of fractures can happen. And what are these fractures? So first is there can be, if even if a person falls from a standing height, there can be a hip fracture, there can be wrist fracture, there can be various sprains can happen. Okay, we discussed a lot about all these injuries last time in my last video. Then breaking of a rib can happen even with the slightest movement, like hugging a person or reaching out for something or closing the window. Yeah, and then ankle fracture can happen if you just miss a step. So it is that trivial. And even spinal compression fracture can happen. So all these are called the fragility fracture because the bone is very much fragile and porous. So minimal forces which go through the bones can actually break them. Okay, next is the T and the Z scores. Yeah, so they are majorly used for diagnosing the osteoporosis. So there are two different conditions. One is called the osteoporosis and one is osteopenia. So whenever there is a reduced bone mineral density, we call it osteopenia. And according to the T score, if your score is between -1 to -2.5, then you have osteopenia. But if your T score is below -2.5, then you definitely have the diagnosis of osteoporosis. Okay, so what this T score does, it compares your score to that of a healthy 30-year-old adults. Okay, so you can generally see people like in clinic, people show their T scores a lot for the bone mineral density. And then there's also Z score, which is used for those whose bone mass has not yet peaked, for pre-menopausal women and for men who are more than 50 years of age. So it is not very commonly used. Okay, so how does how does PTs or how does exercises help in osteoporosis? So we actually can help in reducing the pain level. So whenever there is a hunchback or kind of the loss of height happen because of fracture or because of compression of the bones, there can be different aches and pains can happen in different areas. So we can use different kind of modalities to reduce the pain. We can help in preventing the bone loss, and different exercises can be used, which can be weight bearing exercises, resistance training exercises. Okay, and as I mentioned earlier, the bone mineral density increases or bone strength increases when we do these exercises. So they can be really helpful in reducing or preventing osteoporosis to happen. Okay, then proper posture and alignment can be maintained using the exercises. improve your balance. So various balance exercises can be used to like improve your general balance, so there's a lesser tendency to fall, and a person can be much more confident while doing different activities around the house, and also we can help you in adjusting your environment. Okay, so with this yeah, it is very much beneficial to diagnose the osteopenia or low bone mineral density and osteoporosis as soon as possible, because then kind of various steps can be taken proactively to rebuild the bone strength and reduce the fracture chances. And I think we all because the chances of getting all these fractures and osteoporosis is so high, we all need to be proactive in dealing with such conditions. And there are various even quizzes or tests are there online which you can fill, and can identify if you have the risk of getting osteoporosis in coming 10 years or 20 years. Yeah, so with that I would like to end this video. Thank you so much, and you can contact Move Physio via Facebook, Instagram, or my contact information is there on the site. So thank you so much, and yeah, I'll meet you soon with some other topic. Thank you.